Hello and thanks for tuning in. Today, we're addressing a critical connection that affects millions worldwide, the relationship between diabetes and kidney health. High blood sugar levels can severely impact your kidneys, leading to conditions like chronic kidney disease and even kidney failure. Managing your blood sugar is not just about preventing diabetes complications. It's also about protecting your kidney function and overall health. In this video, we'll explore effective strategies to control blood sugar, highlight the importance of regular monitoring, and share practical tips to keep your kidneys healthy. Understanding the relationship between diabetes and kidney disease is the first step toward prevention. Let's dive in and learn how you can take charge of your health and prevent kidney disease. 1. The relationship between kidney failure and diabetes. The kidneys are important organs in the body responsible for filtering blood, removing waste, and excess water through urine. They also help maintain electrolyte balance, regulate blood pressure, and produce hormones that stimulate red blood cell production. When the kidneys function well, our bodies stay healthy and work efficiently. However, diabetes is a chronic condition that can severely affect kidney function. Prolonged high blood sugar can damage the small blood vessels in the kidneys, reducing their filtering ability. Diabetes increases pressure in the kidney's blood vessels, damaging the filtering membrane and kidney cells. At the same time, high blood sugar levels cause the accumulation of metabolic products, leading to inflammation and fibrosis, which results in kidney failure. High blood pressure, another risk factor associated with diabetes, also contributes to the increased risk of kidney failure. To protect the kidneys, people with diabetes need to manage their blood sugar and blood pressure well. Understanding this relationship helps us take effective preventive measures and protect kidney health in the best way possible. 2. Risk factors and symptoms of kidney failure due to diabetes. High risk factors for people with diabetes, such as unstable blood sugar levels. People with diabetes have a high risk of developing kidney failure, especially when blood sugar levels are unstable. Prolonged high blood sugar can damage the small blood vessels in the kidneys, reducing their ability to filter blood. Risk factors include 1. Prolonged high blood sugar levels. Poorly controlled blood sugar puts a lot of pressure on the kidneys, leading to damage to the small blood vessels. 2. High blood pressure. Diabetes often accompanies high blood pressure, adding extra pressure on the kidneys and harming their filtering function. 3. Overweight and obesity. High body weight increases the risk of developing kidney problems. 4. Smoking. Smoking damages blood vessels, increasing the risk of kidney damage. 5. Family history. If there is a family history of kidney failure, your risk also increases. Early symptoms of kidney failure that people with diabetes should pay attention to. 1. Prolonged fatigue. One of the earliest signs is a feeling of fatigue and lack of energy, due to the body's inability to effectively remove waste. 2. Shortness of breath. Anemia caused by kidney failure reduces the amount of oxygen supplied to organs, causing shortness of breath, especially during physical activity. 3. Swelling. The kidney's inability to remove excess water causes swelling in the legs, hands, and face. This swelling is often noticeable in the morning. 4. Frequent nighttime urination. Kidney failure can increase the need to urinate at night, disrupting sleep. 5. Reduced urine output. Urine output may decrease, or urine may appear foamy, indicating protein in the urine. This shows that the kidneys are not filtering blood effectively. 6. Itchy and dry skin. The accumulation of waste products in the blood can cause itching and dry skin. 7. Loss of appetite and nausea. The buildup of toxins in the body can cause nausea, loss of appetite, and indigestion. 8. Dizziness and memory loss. Anemia and the accumulation of waste products can affect the brain, causing problems with memory and concentration. These symptoms need to be monitored and checked early to detect and treat in time, avoiding more serious complications. Don't forget to subscribe to our channel for more valuable health tips and updates. 3. The importance of effective blood sugar management. How to measure and maintain stable blood sugar levels. Measuring and maintaining stable blood sugar levels is crucial in managing diabetes and protecting kidney health. To measure blood sugar, people with diabetes should use a personal glucose meter and regularly check their blood sugar levels at different times of the day. Key times to check blood sugar include before meals, after meals, before bedtime, and when feeling unwell. Blood sugar readings should be recorded to monitor and adjust diet, exercise, and medication as needed. The target blood sugar levels are typically prescribed by a doctor, usually below 130 mg per deciliter before meals and below 180 mg per deciliter after meals. To keep blood sugar levels stable, patients should adhere to a healthy diet rich in fiber and low in sugar. Foods to include are green vegetables, whole grains, legumes, and lean meats. Limit the intake of sugar, sweets, sugary drinks, and fast food. Regular exercise, such as walking, swimming, or yoga, helps improve insulin sensitivity and control blood sugar. Take medications as prescribed by a doctor, including insulin or oral medications to control blood sugar. Regularly visit a doctor to check blood sugar levels and adjust treatment if necessary. Impact of high blood sugar on kidney health and benefits of proper management. Prolonged high blood sugar can cause severe damage to the kidneys. When blood sugar levels are not well controlled, the small blood vessels in the kidneys are damaged, reducing their ability to filter blood. This leads to the accumulation of waste products and excess water in the body, causing kidney failure. Metabolic products of sugar accumulate in kidney cells, causing inflammation and fibrosis, leading to kidney function decline. Additionally, high blood sugar increases the risk of high blood pressure, another significant risk factor for the kidneys. High blood pressure puts extra pressure on the blood vessels in the kidneys, increasing the risk of damage and kidney failure. Proper blood sugar management provides many benefits for kidney health. When blood sugar levels are stable, the pressure on the kidneys is reduced, lowering the risk of damage to the small blood vessels and the kidney's filtering membrane. This helps maintain effective blood filtration, preventing the accumulation of harmful substances in the body. Moreover, good blood sugar control helps reduce the risk of high blood pressure, protecting the kidneys and overall health. Effective blood sugar management also reduces diabetes-related symptoms such as fatigue, thirst, and frequent urination. It also helps prevent other serious complications such as eye, nerve, and cardiovascular damage. 4. Healthy diet and lifestyle. A healthy diet plays a crucial role in maintaining kidney health, especially for people with diabetes and those at risk of kidney failure. A balanced, healthy diet not only helps control blood sugar levels but also supports kidney function. Eat plenty of green vegetables and fruits. Spinach, broccoli, bok choy, kale, and lettuce are good choices as they are rich in fiber, vitamins, and minerals, especially potassium and magnesium, which help improve kidney function and control blood sugar levels. Apples, oranges, pears, strawberries, and blueberries provide vitamin C and antioxidants, which help protect kidney cells from damage. However, it's essential to control the portion sizes to avoid spikes in blood sugar levels. Brown rice. It contains a lot of fiber and B vitamins, which help maintain stable blood sugar levels and support kidney function. Oats. Oats help lower cholesterol and control blood sugar due to their soluble fiber beta-glucan. Quinoa. It is a complete protein source containing all essential amino acids, suitable for those who need to manage their protein intake. Tofu and soybeans. These provide high-quality protein that puts less strain on the kidneys compared to animal protein. Legumes, lentils, green beans, and black beans are good sources of protein and fiber, helping to maintain stable blood sugar levels. Limit high-sodium foods, processed foods, fast food, sausages, and industrial sauces often contain a lot of salt, putting pressure on the kidneys and increasing the risk of high blood pressure. Use natural seasonings. Onions, garlic, lemon, and herbs like cilantro, basil, and rosemary can replace salt while keeping the food flavorful. Maintain daily water intake. Drinking about 8 glasses of water each day helps the kidneys effectively filter out waste, but you should follow your doctor's guidance if you have kidney issues. Regular exercise and stress management not only improve overall health but also play an essential role in managing diabetes and protecting the kidneys. Walking at least 30 minutes a day helps improve blood circulation, lower blood pressure, and control blood sugar, thereby reducing the strain on the kidneys. Swimming is a full-body workout that strengthens muscles and the cardiovascular system without putting stress on the joints. Yoga helps improve flexibility, strengthen muscles, and reduce stress, benefiting both mental and physical health. Cycling enhances cardiovascular health and helps control weight, reducing the risk of complications from diabetes. Meditation. Practicing meditation for 10 to 15 minutes daily helps relax the mind, reduce stress, and improve mental well-being. Deep breathing. Deep breathing techniques can be done anytime you feel stressed to help relieve pressure and relax. Listening to music. Gentle music can help relax and create a sense of peace, effectively reducing stress. Sleep 7 to 8 hours each night. Ensuring adequate sleep allows the body time to recover, regenerate energy, and improve kidney function. Quit smoking. Smoking damages blood vessels and increases the risk of kidney failure. Limit alcohol consumption. Excessive drinking harms the kidneys and increases the risk of diabetes-related complications. Regular health checkups. Monitoring blood sugar levels, blood pressure, and kidney function as guided by your doctor helps detect and treat health issues early. 5. Preventive measures for kidney failure in diabetic patients. Regular health checkups. 1. Kidney function tests. Periodically conduct blood tests to check creatinine levels and glomerular filtration rate, GFR. These indicators help assess kidney function and detect early signs of kidney failure. Urine tests. Perform urine tests to check for the amount of protein, albumin, in the urine. An increase in protein can be an early sign of kidney damage. Blood pressure monitoring. Regularly monitor blood pressure, as high blood pressure can exacerbate kidney damage. Ensure blood pressure is controlled within target limits. 2. Adherence to doctor's treatment regimen. Medication adherence. Take medications as prescribed by the doctor to control blood sugar and blood pressure. Drugs such as antihypertensives, like ACE inhibitors or ARBs, can protect the kidneys. Dietary management. Follow dietary guidelines provided by the doctor or a nutritionist. Eat less salt, reduce protein intake, and control the amounts of sugar and cholesterol in the diet to reduce the strain on the kidneys. 3. Healthy lifestyle adjustments. Regular exercise. Exercise helps improve blood sugar and blood pressure control. Maintain light physical activity like walking, swimming, or yoga. Stress reduction. Manage stress through methods such as meditation, yoga, or relaxation activities to reduce bodily pressure and improve overall health. The role of monitoring kidney health. 1. Blood tests. Creatinine and GFR. Blood tests help measure creatinine levels, a byproduct of muscle metabolism that the kidneys filter out of the blood. High creatinine levels may indicate declining kidney function. GFR is the primary indicator to evaluate kidney function. Low GFR can signal kidney failure. Electrolytes and waste products. Blood tests also check electrolyte levels, such as potassium and sodium, and other waste products to ensure the kidneys are functioning properly. 2. Urine tests. Albumin in urine. This test helps detect protein, albumin, in the urine, an early sign of kidney damage. Protein in the urine indicates kidney failure and should be regularly monitored. Presence of glucose and other substances. Checking for the presence of glucose, red blood cells, and other substances in the urine can help identify other kidney issues or pathological conditions. 3. Comprehensive health monitoring. Monitoring symptoms. Listen to your body and track symptoms like swelling, fatigue, or changes in urine volume. Performing imaging tests when necessary. In some cases, the doctor may request imaging tests like kidney ultrasounds or CT scans to evaluate the structure and condition of the kidneys. Effective blood sugar management not only helps control diabetes but also protects kidney function. Maintaining stable blood sugar levels helps prevent serious complications that can occur with the kidneys. This is particularly important for those with diabetes to ensure overall health and improve quality of life. By implementing preventive measures and regularly monitoring health, you can protect your kidneys from unwanted damage. Remember, kidney health not only affects their own function but also impacts the entire body. To continue receiving useful knowledge and practical health advice, subscribe to our channel. We are committed to bringing you and your family the latest information to help you maintain the best health. Don't forget to like, share, and subscribe our channel to receive more valuable information. Thank you for watching and see you in the next videos.